Welcome to the next segment of our microlearning program on healthcare quality improvement basics. This program is based on the model for improvement recommended by the Institute for Healthcare Improvement. This segment will focus on the use of data to support your quality improvement efforts. This segment was provided as part of the PATH QAPI Basics series.
Now in QAPI Basics, let's talk about how we use data. In our healthcare QAPI programs, we arrange data into defined metrics to measure performance over time. A metric is a system or standard of measurement, or in other words, the framework for bringing meaning to data by comparing performance over time. Each metric includes a defined data source, data collection plan, and performance goal or target. Because metrics are reported over time, they are often represented as run charts with a specified time frame along the x-axis and performance data along the y-axis. This data visualization approach helps us understand and analyze the data more quickly and meaningfully. Our organizational metrics, sometimes called measures or indicators, define what we are working towards, including what specific targets and outcomes we are trying to achieve and how we show the impact of our work. Clearly defined measures or metrics help us use data to tell our improvement stories. They do not need to be complex and can be as simple as the percentage of your total patients who receive a vaccination or the number of safety incidents reported within a certain time frame. Metrics are used to measure current performance, progress, and impact over time. They are classified as either structural, process, balancing, or outcome measures. Structural measures give patients the understanding of the healthcare capacity, systems, and processes to provide high-quality care. For example, the ratio of providers to patients. Process measures measure specific actions taken during the improvement process, or compliance with generally accepted recommendations for clinical practice. For example, the percentage of people receiving preventive services such as mammograms or immunizations. These specific actions are measured in relation to larger outcome goals like detecting cancer early and prevention of the spread of infection or disease. Most healthcare quality measures used for hospital public reporting are process measures. Balancing measures are used to measure the predicted or unforeseen impact of an action on a process, team, or individual outside of the focused improvement process. For example, if we create an improved process for medication administration, but it requires excessive time, resources, or staff, then it has negatively impacted our productivity and costs. Balancing measures are meant to ensure our improvement efforts are in balance with other processes and priorities. Outcome measures reflect the impact of the healthcare service or intervention on the health status of patients. One example is the rate of infections or preventable readmissions to the hospital. Outcome measures may seem to represent the gold standard in measuring quality, but an outcome is the result of numerous factors, many beyond a healthcare provider's control. For public reporting and comparison purposes, mathematical models are used to consider and correct for differing characteristics within a population, such as environment and social determinants of health. These metric data are meant to be shared and should be reported and presented through data analysis and visualization. Key metric data should be shared widely with many audiences, including leadership and frontline staff, to help support and drive improvement and cohesion. Improvement progress and successes should also be shared with your patients and community. They are interested and invested stakeholders in your improvement efforts and success. For more information, find PATH on comagin.org or email us at path@comagin.org.
The next segment will wrap up this program on quality improvement basics and provide resources to help support your quality improvement efforts.